Welcome to the Healers Café, conversations on health and healing with Dr. Manon.
So welcome to the Healers Café. And today I have Jenna Howe with me. And wow, I think we know each other 19 years. So I'm very much looking forward to having a full update, but let me tell you a little bit about her. She has a diploma in fitness and lifestyle management, a degree in psychology, and has several postgraduate certifications, including concussion health, cancer and exercise recovery. She is a certified Bowen health therapist and a master level neurokinetic therapist, a certified ANF pain therapist, and a certified yoga therapist, as well as a manual osteopath. So, wow, what a wealth of knowledge. And so where shall we start? I mean, I feel like, okay, no, I know where I want to start. Well, welcome. And
thank you.
what got you started in the healing arts, and sort of what prompted you to keep going? And yeah, tell us a little bit your journey.
So it's interesting because I think I before maybe a year ago, I would have said, well, I always wanted to be a physician. In high school, I wasn't necessarily mathematically inclined, didn't want to do physics, barely passed chemistry. So I never really considered that the medical field was something I could really work towards. And the 10 years of education it also turned me off. So I thought, well, maybe athletic therapy. And anyway, and then I kind of rolled into fitness. So I would have normally said that. But this is a question that comes up a lot. And I often think, oh, how did that happen? And then I was like, well, I did start seeing an athletic therapist when I was 16, had chronic migraines, a chronic shoulder issue. So that sort of on the surface makes sense. But if I go a little deeper than that, I had a parent who had chronic migraines, chronic pain. And I remember she had always said that the only thing that made her feel better is if I put my hands on her head when I was little. This parent ended up dying of a drug overdose, prescription related. She was given loads of prescriptions her entire adult life, but I never really made that connection to being a chronic pain therapist as an adult. And now I'm older than she was when she died. And then it kind of just sort of dawned on me, like, yeah, I guess this was always going to be the path, is trying to help people out of pain so that they don't become dependent on prescription drugs, so that they have a little bit more control in their life as far as managing their pain, showing people that there is a way out of pain. They don't have to live in pain and all those kinds of things. So on the surface, it was like, yeah, I had my own stuff going on as a teenager, but the deeper root of it, I think, was just, this was going to be my path no matter what.
Interesting how it's kind of like it's a rewrite, but it's not a rewrite really. It's an in-depth. It's like going to the root cause.
Yeah, exactly, which is what I do. That's my goal, is always to find the root cause of what's going on with somebody. Yeah. And I can be a little obsessive with education. So even just listening to you mentioning all the certifications and so on, and then it goes on deeper than that, right? Because I'm always taking a course, I'm always looking ahead, I'm always, that's really cool. And what I realized is that from the very beginning, I, doing something that I really love, really enjoy, and then I start to identify, well, wait a minute, there's something else that this particular thing isn't quite addressing. What can that be? And then I just sort of think about it. And then usually within a few months, all of a sudden information comes to me through whatever path, other professions and stuff like that. And I'm like, oh, that's the thing. And so then I grab up all that education and work with that, and then build another level. And then again, I see another, a little bit of a gap of like, oh, I wish I could just do this. And then all of a sudden another training comes in, and it always comes in at the right time when I'm looking for a way to amplify the results I have in my clients. And then all of a sudden I'm being presented with information. So I'll be doing this forever.
Well, it is like that, right? And even every therapy evolves tremendously if you stay very connected to exactly that. Like I'm an endless learner as well, because it's just like, what else, so I mean, I'm thinking it was 19 years ago that you took Bowen Therapy, right?
Yep, I probably finished my advanced class or just finished my module 6 in this month, so December. Yeah, 19 years ago.
Yeah, wow.
So this would be like probably my 19th anniversary, funny enough, of being a Bowen therapist. Yeah.
Interesting. So, well, why don't you tell us a little bit? Yeah, and I get that. Once you're putting it out there in the universe, it shows up, right? And that is actually how our brain works. That is how it does work, right? So once you identify, you don't even have to know what the gap is exactly. You just need to know that there's more. At one point, I called my clinic for people who know there's more.
Oh, yeah.
That was the tagline, because it's like, how can I identify what it is that we're really dealing with? So it is kind of like that in that search. So how did you find, I mean, what attracted you to Bowen Therapy, and and are you still using it? What's going on with that world, since that's one where we connect?
Yeah. So the way I work when something comes to me is I hear it, I say yes, I do it. So what had happened is that I had gone to college with one of my closest friends I met in college, Denise Cameron, and she went on, after we graduated from the fitness and lifestyle program, she went on to become an RMT. We both have children in and around the same age, so we were just sort of having this like crunched in conversation between kids in the background. And she was telling me that she was taking this really amazing course and she wanted to tell me about it. And at the time, I felt like I had sort of, what would be the word? I kind of settled for the fitness and lifestyle management. So at that time, at that age, I didn't really push for the things I really wanted. I settled for what I thought I could do. And so working with, athletes and new moms, I was doing fitness programming, nutrition programming, exercise rehabilitation, but people who still had chronic injuries that I wanted to help work with. And then so when Denise was telling me about Bowen, I had no idea what she was even talking about. I said, that's the thing. That's what I'm going to do. I was like 9 months pregnant when I signed up for the class, clicked send, there's my money. And then the course didn't even start till June. So I was I hadn't even had my kid yet. So I was like, sweet, this sounds like this is the thing. And Denise was like, well, maybe I should come and give you a treatment before you take the class so that you actually know what it is that you're going to be doing. I said, oh yeah, that might be a good idea. But I just knew, I heard it and I knew it and I went for it. And honestly, it's the basis. I mean, I've got, I might see anywhere between 20 and 25 patients a week. And a large majority of them are Bowen based. Some of them are just strict Bowen. I've got 2 sessions this afternoon, actually, that are just strict Bowen. And everything else is a combination, but Bowen has been the foundation of my entire healing career. And so I always come back to that, even if it's, outside of the traditional teachings, I'm still infusing it with whatever I need at whatever time I need. It's always there.
Well, when you say the traditional teachings, so I have evolved as well. Because at the time, it was done a certain way. It was mostly a physical therapy. It was a technique rather than actually honoring that it's actually an art that has very much to do with also the connection between the client and the practitioner. And so now at Bowen College, we really stimulate the creative ability. You need to know the baseline, but we have to think out of the box. We need to use all of the skills, whether it's, Chinese medicine, knowledge of meridian, knowledge of fascia, knowledge of even the understanding of healing, which was really taboo at the time when I was teaching. I wasn't really able to teach what I knew. And so it has evolved as well. So it's interesting. And it looks like some of the courses you've taken are like, yes, like it all makes sense, so
it all just pulls in together. And it's very interesting because I have another friend who has stuck with the very traditional approach and teaching. And so usually when someone comes to see me, like it's hard to go more in depth because I know the listeners might not understand completely what it is that I'm talking about. But whenever this friend and I get together, we'll do a trade. But our application of the same thing is actually quite different, and I find it fascinating. And when I've got people who come in who've had previous experience, I just explain to them like how it is that I'm different, my approach. And then I really welcome dialogue with my client base and just say, this is the type of pressure that I use, but this changes based on the individual that's in front of me. Right. So it just varies. And then, it's at the end of the day, you just have to love Bowen.
So one thing too, you've been treating a lot of concussions because I've been reading things that you've written about it, and and following up here and there through the grapevine, which is quite short. So tell us maybe what you've seen or what's possible for concussion people that are suffering with concussions.
So I started using Bowen for concussions in 2003. And so at that time, concussions were still, there was, from a media perspective, it was like, oh, this is a thing now. Like it was just emerging in terms of a topic of conversation, but not a huge topic of conversation. And, and how I came to, and again, some of the things that I come across, it just is random. So I was looking for sports mentorship with Bowen and sports therapy. I was teaching at the college. I had athletes and anyway, it just made sense. And I met up with Craig Matimo over the phone, and we became fast friends, lifelong friends. And so he kept going on about this concussion thing. And at the time I was like, meh, whatever, like it didn't really resonate. Well, one of my students, so I was a instructor at the college, local college, and one of my students hired me as a personal trainer after she had graduated. And then she had called me up and said, I can't come, I was concussed. I was like, oh, I said, well, you know what? I do this therapy that's supposed to be really amazing for concussions. Why don't you just stop by the house and I'll just do whatever. I'll just do, I think I did half the protocol. I mean, it was it was amazing. I couldn't even believe it because she said 3 hours later. So at the time they graded concussion. So it's considered a grade 2 concussion. Headaches, dizziness, nausea, hard to drive, couldn't exercise, all the things. And she said within 3 hours of leaving my house, every symptom was gone. And so then I called my friend back. I was like, so this concussion thing, it's a thing. He's like, this is what I've been telling you. So that was my start down this road. But at that time, nobody was treating concussions. Like he worked really on acute young athletes. That was his thing. And what I found is that I was starting to get chronic people. So I was using the protocol, the concussion recovery protocol, using Bowen, but having to apply it to chronic situations and figuring out the nuances with these chronic situations, the differences between men and women, older people, younger people, car accident versus sports injury. And a lot of it was a lot of self-education. And that's kind of how I ended up grabbing up all of these other programs and certifications along the way, is because, the concussion there's a lot of layers to that, depending on the type of person that you're working with. So, and over time, I kind of predicted, probably not publicly, but just sort of in my head, is that there's going to be these waves. There's going to be the recognition of concussion. Then there's going to be the whole like management of it. And then it's going to dip down, and then it's going to come into treatment. And so now we're in the treatment phase. It's still very much management from a very clinical perspective, but I just keep riding my little wave. I just do what I do. And people find me anyway. And so it's just been really interesting over the span of like 18 years, watching, sort of this wave and how it's coming more to the forefront. Yeah. And it's a lot of fun working with concussion people as well.
Well, because often, I mean, it wasn't my main thing in my practice, but certainly people showed up with concussions.
Yeah. Yeah.
So I've got to figure this out. And like you said, it varies a lot on so many different factors.
Yeah.
But what I've found too is that there's a sense of hopelessness that, the brain won't repair, and they'll have to sort of take things and deal with reality, the way it is now. And it's like, wow, this can't be true. So even though I did not know when I started, when my first patient came, I was like, oh, okay, time to go deep on this one.
Yes.
But I'd seen that everything else was not true, that it's not true you're stuck with chronic diseases. It's not true that things are incurable. And then it's like, okay. So let's do this, and I've been amazed as well at
it's really fantastic. And the unfortunate thing is that by the time people come to see me, they've been suffering for quite a while.
Yeah.
And they've been told by specialists and so on that, well, this is just the way it is. It's never going to change. You're just going to have to deal with it. And that doesn't help anybody. And I've always been the type of person who I believe there's a solution to every problem. I may not have the solution personally, but there's going to be a solution somewhere. There's going to be a way to deal with whatever is going on. And so oftentimes when I start working with people, and I'm a huge educator, so I educate people on, here's why I'm assessing these particular things. Here's why I'm doing what I'm doing. Here's why I'm using this therapy at this point in time, and how this is going to be affecting the body, and then what to expect. And then people feel a little bit more empowered because now they have a better understanding of what's actually happening. No one's actually told them what's really going on with their visual system, with their neck, with their jaw, whatever it might be. And then I give them maybe very unique and specific to them prescriptive exercise, so that again, they've got something that they can do at home that genuinely feels like it's going to be helping them.
And the other thing too, the fact that they're getting involved also refocuses their attention to that they are empowered beings. They have something to do with the outcome, rather than being like the victims receiving.
Yeah.
Words,
Exactly.
Hands, and it's like, no, it's not like that.
Yeah. It's definitely, a back and forth, right? It's a partnership.
Yes.
Between the therapist and the patient client. And I explain this to my clients as well, like, you can choose not to do your homework. You can choose not to do all these other things. But when you do them and you come back and you give me feedback, then that makes me a better practitioner for you, because then I'm not like knocking on the same door with the same result. I need the feedback so that I can then adjust whatever it is I need to adjust in order to be the best therapist for you. And so when I explain it to them like that, they tend to, not everybody, be a little bit more motivated to do their half. Yeah.
Yeah, no, it makes total sense. So what else can we talk about? There's so many things.
I know. Yeah.
Well, I think it also helps people to have a real story, a real person, no names, obviously, but what's something that surprised you in your practice? And it doesn't matter what therapy combinations, it's not really about that, but what's the human potential? What did you see that you couldn't believe? I don't know, myself, I'm always amazed. I'm always going, oh my gosh. And I'm,
yeah,
illegal now. You can't hug your patients, but I would.
Oh, my patients hug me all the time.
Hi, I'm Dr. Manon Bolliger, and I wanted to take a moment to thank you for watching these podcasts. If you haven't subscribed, please do. Also, feel free to leave comments and like it. This way, more people get to find out about this work and about other choices for health. So I think it's really important that we all share this information. I have a free gift to you. It's a 7-sequence email that has tips for every day, and it's a little insight about how to live your life when it comes to health. And it's very much built on how I managed to overcome stage 4 cancer and what it took. So I would love you to have this, and thank you once again for listening to these podcasts.
COVID or no COVID, I get hugs. I think, it's hard to isolate because it happens so frequently. Because I'm always invested, I'm like a detective. And so the feedback I get from my clients is that they can feel that I genuinely love what I do. Like, I genuinely love what I do. And for example, if I'm doing a neurokinetic assessment and I find something really cool, I can be a bit hyper. I talk a lot in my class and like in my sessions and whatever when it's appropriate, but I'll get giddy. Like, I'll jump up and yay, or like, oh, that's so cool. I've been doing this for years and it's still so cool how the body responds when you do certain things. And I can't help it. I've tried not to, and I just can't help it. And it's like, whatever, that's just who I am as a therapist. I get super excited. But I will say the one thing that sticks out, and it was fairly recent, somebody who had been having this chronic pain. This was really cool, actually. This was super cool. And this is the importance of taking a really thorough history and really leaning into what they're saying and really working on timelines of injuries, surgeries, whatever it might be. This crazy chronic pain, no car accident, no nothing, but it ended her career. She couldn't get resolution, 4 years of chronic pain, not being able to work, bouncing from thing to thing. The first thing we did is I actually ended up doing some scar tissue release on an old hysterectomy scar, because she had said, I don't understand it. She's like, but within 30 days of that surgery, all my pain happened. I just woke up one day and all my pain was there. I'm like, that is really important information. She's like, people told me I was nuts. They gave me antidepressants. They sent me to a psychiatrist. And I was like, no, I mean, anatomically, everything is connected. right? You just have to look at the anatomy trains, anatomy coloring book. I still have mine from 25 years ago. It's all connected somehow. So we actually did scar tissue release, and that was the first major. She's like came back and was like, what just happened? And then we started working on getting some muscles firing in the appropriate way. And then then the right time was to do, I added shockwave to the mix and done in a very particular way, so that it reduces discomfort but gets results, because people get scared off of shockwave. And honestly, when she came in, I almost cried when she came in and just said, I can't believe it. She's like, I had no pain for 2 days. I haven't had that in 4 years. And it was just, so what I learned from that is just the connection you have with your client, to really have good dialogue, to really, and to be genuinely invested in solving their problem, is the one thing that I just hold on to, that each person comes in with their own history, their own whatever. They're not just another person that's walking through the clinic and you just, oh, there's the chart, there's the chart, there's the chart. Each person, I'm genuinely invested in helping them solve their problem. And I just continue that even on the hard days, even if I have my own pain on that day or I didn't sleep, it's just, I keep getting invested in that person at that moment. Yeah. I felt like a ramble, but I hope that answered the question.
It's a genuine inquiry, right? It's like, it's not, you have solutions, but you don't know which ones you're going to pull until you really identify what is the basis, what's going on. And sometimes, I'm sure you've seen this, that sometimes it's also emotional, which then has a physical manifestation. But if you don't give the opportunity to allow for that to surface, you're chasing it. It isn't fully released, and I think all kinds of trauma, it's like that, and as well as if we don't work with the autonomic nervous system, if we don't deal with the shock of an event,
nothing else is going to happen.
Nothing's going to, exactly. That's why, I don't want to put down therapies, but there's many therapies that don't focus on that at all. And so people are in it, for 2 years and they're getting, 10-20% improvement, whatever. But they come and see a person like yourself, and it's like, it's solved because you have to talk to the whole body.
Yeah. And when people ask me, like, so sometimes when I'm working with somebody and we're really sourcing out what's really going on, and they'll say, well, why didn't anyone else tell me this? Like why didn't whoever it might be, why didn't they tell me this? Why didn't they explain it to me? I'm like, I can't speak for other people. I just know that this is how I work, and I'm a detective. And I get obsessive about it. And that's just the way I am. And I said, but there's a time and a place for everything. And so right now, this is the right time for this particular approach. And maybe down the road, if there's something else that's going on, then the other thing, because oftentimes people will work with me temporarily and it makes things better, and they go back to their regular person that ends up working a little bit better. Sometimes they'll come back to me 6 months, a year later. Like, it's really interesting. And I had to, over time, especially as I got older, is just sort of take myself out of the mix and just say, this is what I have to offer at this time. And it may not be the right thing at this time, maybe down the road, the other thing. So again, when people say, oh, should I quit doing this thing? I said, it's not for me to decide. You have to check in to see what your body feels. And often I find myself saying to people, you know your body better than anybody else. You're living in your body. So I can say, here's my assessment, here's what I'm feeling, here's whatever, but it's your body. So you might walk out of here and go, well, that was nice, but I'm not so sure. Well, you have to honor that. Like you can't say, well, I'm sorry, but, and I'm no, there's no personal I can't take it personally as a therapist. And I just remind people, if this is how you're feeling, then you have to honor that that's how you're feeling. When people say, oh, I really think it's like this spot right here. And I'm like, then it probably is. Let's look at it. Let's figure it out. Let's assess it and see. And almost 100% of the time, I can validate why they're feeling what they're feeling. And then they're like, oh, see, I knew it was that. I'm like, of course you did. It's your body.
I think you've hit on a fundamental thing that, now we're clearly letting every practitioner understand the depth of that. And there's much more research to back it now and all of that, but it's so fundamental. Whereas the old model is still the doctor knows better or the therapist knows better. And it's the biggest disconnect. We know better, the person receiving it, not necessarily exactly how to fix it. That's why there's a team.
Yes, exactly.
Know that this is what's going on, right? And it's just, and it is, it's funny, you use the word detective. That's what I used to say. I'm a detective.
Yeah.
You want to be when I grow up, a detective.
Yeah. It's it's really fun. And lately, I've been really, it's hard to explain, but I just, over time, people are like, oh, you should do this and you should do this and you should write this and you should create this. And I can be a little ADD and like, oh, I want to do this flashy thing. And finally, I finally just said, wait a second. This is I actually just genuinely love doing what I'm doing. 6 or 7 hours out of the day, having wonderful, cool conversations with clients. And maybe not every client loves how chatty I am, but I have learned so much from my clients, just as a person, as a therapist, as a mom. They're just people. We're just coming together to solve a problem. And so I finally just sort of sank into that. I'm like, I don't have to do this thing over here. I don't have to do that thing over. I don't actually have to do anything else other than what I'm actually doing right now, because I really, really love it. And then that's it. Like as a therapist, it's like, I don't have to do all the other stuff.
So I'm curious your relationship to the part that most therapists neglect. It's like there's a belief that you open up and the patients will come. Now, there's a truth to that. Patients will come. And there's also a truth that if you get results, there'll be a referral. But there, and that is a way that you can grow the business. But in this age, being present on another level seems to be required for many. So could you speak a little bit about the general idea of marketing? What do you do on that level?
Yeah. So as a self-employed person who never purposely went into self-employment, I did that to myself by always doing something outside of the norm that isn't necessarily employable, because nobody knows how to market you, like, is the thing, right? So I just naturally got into just being self-employed, and then spending years trying to figure out how to do this newsletter and that thing and all the stuff. And then, and getting into a coaching program that they're like, okay, we're going to teach you how to do all this. And that was a very expensive way to go. I don't want to do any of that. I actually just don't want to. Like, I just dig my heels in the sand. No, I don't want to do it. It's not what I'm good at. It's not what brings me joy. So eventually I actually hired a marketing and promotions company that works specifically with physical therapists, chiropractors, osteopathic therapists. That is their whole thing. That's all they do. They don't take on people who are also doing accounting as their business, and they're only for healthcare providers. And honestly, it's not a cheap way to go, but it was the best way to go, because you know, they write my newsletters for me, which were all fantastic. They do my social media for me. They update my website. As soon as I change my website, my clients are like, oh, I noticed you changed your website. It looks fantastic. And as somebody who's self-employed, who just felt bogged down by all of the other tasks that is really required, especially in this day and age, I just gave it all to them. And so that gave me the freedom to just do the things that I love to do. And that was really important, to just delegate that piece and really make the decision of, I really don't like that task. And if you're constantly having that, I don't like that task in the back of your mind, it affects how you move through your day, in my opinion. And because then you're constantly thinking, oh, I got to do this thing and I got to do that thing. And nope, they do it.
Oh, that's brilliant. Yeah. And you know, what I've had to do for Bowen College is include this. So what a lot of people were doing is they were delegating, but it wasn't really a delegation. It was an abdication.
Mm-hmm.
It was like, take it, and I don't know anything about it. So what I've done now is train people to know what they can delegate, what to look for, to really understand this, so that, I mean, it's truly, don't do what I did, because I made so many mistakes. You know?
Oh, and the mistakes are expensive.
Yeah. How to lose your website, how to do this. You know? I've been there, done that, how to lose your name, how to, you know, like and how to, you know, I have nothing against a good investment, but it has to be an investment, and there has to be a clear return, right? And
it has to be the right investment.
Exactly, where you feel like you're getting something and you're actually attracting more people. And part of it is, why are we doing this? It's not to spend money, it's to reach people who desperately need your services and would not know about you.
Yeah,
that's basically it.
And at the end of the day, so not only did it increase, it increased my traffic overall, increased my traffic, but what's really interesting is that, I mean, it's a great website. Love my website. I mean, I was a part of the process in terms of, like, you know, picking different things and approving different things. But, you know, what's really been interesting is that, how do I put this? It's the people who are drawn to me and drawn to my website are always the right person, or it's always a good fit, or, you know, there's going to be some people I might only see once or twice, and they were like, well, that was nice, really liked you, but I don't know, this isn't really, you know, working for me. And that's fine. It's usually when there's a mechanical issue, you know, they've got pins and wires and hardware and whatever. It's a bigger issue than what I have the capacity to treat, and that's fine. But I have to say, making that switch also is just bringing me individuals who are genuinely interested in what I have to offer. And that's been really cool, because wasn't necessarily the purpose behind the website. If you look at the website, you don't necessarily see anything written for that. And yet, but that's also what is coming through the door. And so it's great. So that one was definitely a worthwhile investment.
So Jenna, our time is already passed.
Yes, I know. We could probably talk for hours.
Last word.
Yeah.
What would you like to leave people with?
Oh, that could probably be more than just one word. But I would just say, I think when you tap into what you truly love about the work that you're doing, then your clients will feel that. And I think that's the biggest piece is, you know, if there's an aspect of what you're doing that you don't love, but then there's another piece where you're like, oh, I really just love doing more of that, then do more of that, right? Things will shift naturally to accommodate that. But I think it's really well worth it to figure out how to do this work, because it's very easy to get overworked. I definitely was overworked pre-COVID. And so COVID lockdown and all the stuff forced me to reevaluate a bunch of different things. And I just hone in on what I love, and everything else is falling into the place the way I want it to. And so then I'm not overworked. And I do come out of the day feeling inspired by the clients that I'm working with. I feel energized enough to come home and make dinner and do the exercise and do all the things.
Thank you so much.
Well, thank you so much for having me. It was really wonderful.
Thank you for joining us at the Healers Café with Dr. Manon. For more information, go to drmanonbolliger.com.